Hello, testing, testing, testing. Okay, uh, testing, just to be sure everything is working. Okay, testing, just to be Okay, good morning. Today is Saturday, June 18th, 2022. This is our morning Saturday yoga therapy session. We brought this session from our personal and collective experience, and today's topic is skillfulness in our daily routine. So first, what we are talking about. With our experience of practicing yoga therapy for a long period of time, and especially practicing scientifically with using a health tracker. This is my Apple Watch. You can use your Fitbit or any other health tracker, and we have all the collected data. So from our experience, a daily, regular practice of yoga with a daily maintenance of a routine, what is called a dinacharya, creates the first, a treatment of the chronic lifestyle related diseases, which we call roger chikitsha. Then also it creates what is called maintenance of health, which we term shastha rokha. What we've been experiencing now more and more, that the people who got benefited, and the benefit of yoga therapy is called the art of transformation. What is the art of transformation? In the simplest, we call it a Sanskrit word. We said we transform from rogi. Rogi means people with the underlying chronic lifestyle related disorders. For example, diabetes, hypertension, coronary artery disease, truncal obesity. You know, this truncal obesity is one of the most serious conditions today. So rogi is the people with underlying condition or ailments, transforms into nirogi. That means no disease, no ailment, no lifestyle related disorders, and finally transforms into yogi and yogini, who are a carrier of health and wellness. Rogi to nirogi to yogi is called art of transformation, and it only happens with the daily yoga practice. And skillfulness primarily means, remember, primarily means that adopting a regular timing practice and regular timing daily routine. Wow. But you know, it's very simple. If you keep on doing same thing, you develop a phenomena called neuroplasticity. Neuroplasticity lets you to do things exactly the way you have been practicing. So let's start showing you what we do in our daily routine and also how to do it skillfully. Skillfulness also means that you listen to your body signal, you start from where you are and progress slowly. And we always say in stages, impossible become possible. Listening to your body signals are very simple, no pain. Any practice you do, there should not be any pain. You may have a little discomfort, which is, we call it a comfortable discomfort. Excuse me, sorry. It's a comfortable discomfort, and it should be completely effortless breathing. Very, very important concept. The moment you have an effort in breathing, you won't be able to progress. So, let's start. What we do first thing in the morning, and chronologically what we do, and I will give you the timing, what timing we do, and how do we progress slowly. It happened to all of us. It happened to me. We have transformed from Rogi to Nirogi. Now even we are all yogi. That's first thing in the morning. What you're talking about. First thing in the morning, we are talking about, let's see, how to get up, what to start, and when to start. So, we as a yogi and yogini, we sleep on our left side. I'm sure I have shown to you before how we sleep. When you go to bed first, we sleep like a baby. We sleep like a baby. Then we incorporate our breathing. We incorporate our breathing practices to help falling asleep. So let me, at least before we get up, let's start. How do you sleep? Well, I have shown it to you. And skillfulness is very, very important. And as you know, skillfulness means doing the practices on your capability. It is a non-competitive. You are not competing with anybody. So if you have seen a baby, how does a baby sleeps? Baby sleep with an asana called Supta Baddha Konasana. Laying down your closed angle feet. So a baby, if you see an infant or a baby, will lay down into their floor. Generally lay down. Be sure your chin is little bit on below. You don't want the chin to be sticking high up. If the chin is sticking high up, initially you can put something underneath your head. Later on, in a short time, you will do it. So if you look at an infant, all the infants sleep like this. They put the feet together and they will put the knees on both the sides. So you try. Initially, you may have a problem putting it like this. If you feel any pain, you back off. Start where you are. Little discomfort is okay, comfortable discomfort. Then if you want a little bit more relaxation, you can put a couple of pillows, like pillows under your knees. So when you'll be putting it under your knees, and then put your hand on the side, palm facing high up. This is an absolute important practice because sleep, remember, the good sleep is the therapy for all the lifestyle related disorders. Lifestyle related disorders are due to your sympathetic overdrive. That is due to your stress. A good deep sleep. People always ask me how long sleep. There is no time frame for sleep. Sleep you need is a deep sleep. 6 hours, 8 hours, laying down, turning, tossing is not a sleep. Two types of sleep. One is called a REM, rapid eye movement sleep, at which time your mind is still awake and alert. Even if you're sleeping, there is no beneficial effect of sleep in your body and mind. It is about 25% of your sleep. Non-REM sleep, non-rapid eye movement sleep, 75% of your sleep. It has 4 stages, stage 1, stage 2, stage 3, stage 4. Stage 1 and 2 about 50%, stage 3 and 4 is about 50%. Stage 3 and 4 is called the deep sleep. At that time, all the body regeneration and refreshing effect takes place through a multiple hormonal balance and activation of your parasympathetic tone. Almost all the new health tracker, Apple Watch, Fitbit, you can, all of them today show your sleep pattern, especially the deep sleep. From this, next thing you do abdominal breathing. If you see a baby, Baby does abdominal breathing. When they breathe in, the stomach will go high up. Breathe out, stomach will come down. Skillfulness, very, very important word. Breathe in, breathe out. In like all the yoga practices, your breathing out is longer than breathing in. Next, you incorporate longer exhalation than inhalation. Exhalation is parasympathetic, inhalation is sympathetic. My practice is about 15 to 20 times abdominal breathing, then about 5 to 10 times extending exhalation. The way to do it, breathe out first, and breathing in, count of 5 in. Breathing out, count of 10. Five in and 10 out. Now, if you cannot do it, if you feel that you have some effect on your body and mind, you're uncomfortable, do it the level you can do. Count of 2 in, count of 4 out is fine. But if you keep doing it, in a short time you'll see you'll be able to do count of 3 in, count of 6 out, count of 4 in, count of 8 out. So I will do this about 5 to 10 times. Because of the short of time, I'm just showing you the technique. I also straightened up my leg after a while because we need to get into call a fetal position. Next, incorporate the breath holding. Skillfulness, what I'm trying to say, you're doing it right with a level which you can start finding where to progress slowly. I will do breathe out first, count of 4 in, count of 16 hold, count of 8 out, and I will do also that 5 to 10 times. Show you one time how to do it, and if you're practicing with me, you can do it nicely at your home. Breathe out first. Breathe in with a count of 4 in. Hold the breath for count of 16. Breathe out with a count of 8 out. This is one cycle, then I'll continue it between 5 to 10, but if you can do it one time, whatever your body will allow you at the beginning, you do it. Next, we bring the balance within our body and mind to go to sleep. At the beginning of our sleep, our body core temperature is high. When you are sleeping, our body core temperature comes down and all the muscles get relaxed. So initially, we turn on our right side. I generally put my head in my folded hand, bend my knees like a fetal position, and breathing out longer than breathing in. This way, left nostril opens up. Left nostril is cooling, moon energy, parasympathetic activation. It balances the warm, heat, body core temperature. After a short time, we'll turn to our left side. And that's the way all the yogis sleep, including us, including me. I will sleep. I might put a little bit of a pillow. Put a little pillow. This will be nice. Put your hands on the side. You are in a fetal position. Now your body core temperature is coming down and you're breathing through your right nostril. The right nostril is your warm. It's called Surya Nadi, sun energy, sympathetic, going to balance the cooling inner core. Right side also has here a channel called inferior vena cava, which brings all the venous blood to your heart. It is a low pressure system. If you sleep on your right side, your abdominal contents will compress and the venous return is less. And this is the way you get a better venous return. You get an increase in the preload, P-R-E, preload of the heart, and a relaxation response. You have a decrease in the afterload. Most of the cardiologist and physician understands. When you increase the preload and reduce the afterload, your heart function gets better and better. Then slowly when you get up, keep your right leg straight, put your one hand support, you get up and sit down. When you are sleeping in a bed, when you get up, we ask you, what is from our personal experience is that don't get up suddenly. Your body and mind needs to be readjusted. Sit down next on your bed with the feet hanging down, and we call it a rule of 90. These are what the skillfulness means. Skillfulness means doing it right, doing it on timely wise, and doing it in stages what you are capable of doing. You're not competing with anybody. So sitting down on the bed with your feet down, 30 seconds. Then slowly get up and wait. Because if you suddenly get up from sitting down, you develop what is called a postural hypotension. It creates postural hypotension means when you try to raise up, blood pressure drops down. Hyper means blood pressure goes high up. Hypo means blood pressure comes down. Blood supply to your brain comes down, and you can have a sudden blackout spell. You might even fall down. You might hurt yourself. It is an adaptation. It is, we call it acclimatization. How to get up from the bed with a rule of 90 seconds. Slowly walk. First, daily practice. Sitting down next to your bed. We keep in our nightstand a glass of water, and the water becomes in the room temperature by overnight. In traditional yoga practices, they keep the water in a copper vessel, like a copper glass. If you find a copper glass, it's fine, and copper glass is very easily available these days. And you can put an Amazon, and the copper glasses are plenty there. Then you sit down in a squatting pose. And this is a very, very important practice, that you're able to sit down in a squatting pose. Now, I cannot sit down in a squatting pose. No issue, no problem. Do it in stages and follow your body signal. So, if you want to get up, If you want to go down, you can go down. You can even hold, like here I'm sitting holding in a chair, and I will come to a posture where I don't have any pain and I have an effortless breathing. I will stay in this posture with my eyes closed with a 5 to 10 breath. And all yogic breath is breathing out longer than breathing in, at least 1.5 to 2 times. In a short time, you'll see you'll be able to go down. When you come down here, stay here. Even if you have to hold something, hold on to it. But the whole staging will take place with your breathing, with your timing, and listening to your body's signal. For all practical purposes, please do not take a pain medication and then practice physical asana. Because this your body's pain is going to guide you. Body's pain is going to guide you how far you can go. Initially, even if you cannot do, you can even sit down, like here is a chair, you can sit down nicely in a chair. Sit down in a chair, and from the chair, what you do, hold your chair, and you can, let me show it to you what you do with a chair. From a chair, holding it, slowly you get down. So hold your chair, use the chair as your support and guide, and come down. Once you're able to do your squatting pose, which essentially we call it a Malasana. Mala means your excretion. It helps you first bowel movement in the day. Helps you clean all the toxic elements in your body first thing in the morning. Worst thing we do, not to have a bowel movement first thing in the morning, carrying the dirty stool inside you and creating a tremendous lifestyle-related disease. So, in the squatting pose now, what we do, I hold the glass of water and I start drinking water in a gulp. So skillfulness means listening to your body's signal and following it. I drink a glass of water and swallow it in a gulp. Take the next water and swallow in a gulp. In a gulp, when you swallow, you might do a 1 or maybe 2 glasses of water based on your level of comfort. And then what it does, that swallowing with a gulp starts your peristalsis. Peristalsis means contraction of your whole gastrointestinal tract. Gastrointestinal tract comes from your mouth, going down to your pharynx, going down to esophagus, gastroesophageal junction, stomach, duodenum, small intestine, large intestine, right colon, transverse colon, left colon, sigmoid colon, rectum, and anal canal. This peristalsis contraction in the gastrointestinal tract is also guided by your parasympathetic nerve. Parasympathetic nerve is called calm and digest. Also, in the morning, when you put a water in your stomach, the stomach stretches. When the stomach stretches, it causes contraction of your colon, primarily rectum and the sigmoid colon. It's called the gastrocolic reflex. Gastrocolic reflex helps contracting your lower part of the colon. This squatting pose helps straightening up your called anorectal junction. Between rectum and anal canal, there is a little bit of a kink or a bend, which is controlled by the pelvic muscles called the levators. It's like a sling. So what a sling does, in a normal time, it prevents an incontinence. Like I'm not having a bowel movement or stool throughout the whole day. When I sit down in this squatting pose, the junction between the rectum and anal canal straightens up. All the muscles on my pelvic floor relaxes. I have a very easy bowel movement. This does not happen when you are sitting in a commode. But we are very creative. I know many of you might have seen, called your Squatty Potty. Squatty Potty, easily available from your Amazon. You put it, it comes in two heights, a 6-inch and 9-inch. If you have a 6-inch height, which starts at the beginning, I have the 9-inch height. I always have it my Squatty Potty on my, come on. And after the water, when you are using the time, you use a relaxation. Best relaxation is put your hands, separate your fingers. Relaxes your hand. Extend your wrist, relaxes your wrist. Put your one elbow inside, other elbow inside. Slowly bring your hand close to you. Keep your spine straight, eyes closed. Breathing out longer than breathing in. Five to 10 breaths, and then slowly I get up from here, in a standing position. Very slow, gentle movement. Once you get up in the standing position, you like to keep yourself straight, high up. Best way to do is to put your both the feet together and keep your body next to a wall. So if you keep your body next to this wall, you will see your body is straight. So keeping your spine straight skillfully in stages is a part of daily routine. And my ankle is touching the wall, my whole body, and my head goes and touches the back of this wall. This is the painting, but I'm actually against the wall. Then you can raise your hand high up. Keep all the way high up, touching the wall. Close your eyes and breathe out longer than breathing in. Your breath, able to relax, able to breathe effortlessly. Is the part of yogic routine. The moment you feel a little effort in breathing, you are going to have a lot of discomfort. So for the breathing, we have these muscles of respiration. The muscles of respiration are called skeletal muscles. Skeletal muscles means these muscles can be trainable. Like my whole body muscles are skeletal muscles. So I can, like if I do a weight training, I can do 5 pounds, I can do breathe in, breathe out. I can do both. Slowly I'll be able to do 10 pounds. After a few weeks or months, I'll be able to do 15 pounds. I can do 20 pounds. I'll be able to do 25 pounds. Goes on and on and on. Same way, your breathing gets better and better effortlessly. Lung has a 6-liter capacity. You need 1.5 liter to keep the lung open like a balloon, then a 4.5 liter which you can exchange. That's called vital capacity. And we only exchange 500 cc. So we're 80 to 90% lung have a reserve. So initially I could do 4 seconds out, 2 seconds in. So our practice is first, empty the lung slowly as long as possible. We all talk about deep breathing. Deep breathing will come slowly to you. Don't even think about it. Think about how to slow down your breathing rate and how to slowly increase the time of your inhalation and exhalation without any effort. Your whole practice will be like as if it is a normal breathing. What is a normal breathing? You can talk, you can breathe. So for creating that environment for a relaxed breathing, you need to relax your body's upper part. Now remember one thing, in yogic tradition, it is called holistic, that means whole. The moment I relax my upper part of the body, my also lower part of the body also gets relaxed. My whole body gets relaxed. So practice, even standing up, you can do it better sitting down, but even standing up, I do standing up, so we do practice standing up. Prayer pose to the back, Paschim Namaskar. So slowly take your hands to the back, wherever you can. Keep your spine straight. Keep your eyes closed. You breathe out longer than breathing in. Remember, normal breathing rate is between 15 to 16 per minute. If you can do 4 seconds out, 2 seconds in, your breathing cycle is already 6 seconds, and your breathing rate will come down to 10. Lowering your breathing rate increases your longevity. Extending your exhalation increases your longevity. Increasing the volume of your tidal volume, like amount of air you can breathe in and out, increases your longevity. Slowly your hands will come like this, and in stages, hands will get into a prayer pose. The moment you get into the prayer pose, you stay here with your eyes closed, do the breathing out longer than breathing in effortlessly, and you will see your hand is started to go high up because you get more and more relaxed. You will see the length of your breathing cycle gets longer and longer. We have been doing it for so long, we can easily do 6 seconds in, 12 seconds out, 8 seconds in, 16 seconds out, and also we can go up to 10 seconds in, 20 seconds out. But we do it completely effortlessly. For example, I can show you very clearly. Let me demonstrate to you 6 seconds in, 12 seconds out. I'm breathing out first. Six seconds in. 12 seconds out. Very simple for me. So we keep our hand in a prayer pose to the back, Paschim Namaskar. Now we start relaxing our neck. Generally, we like you, if you're starting at the beginning, initially sit down in a chair and do it. Because when you start relaxing your neck with the neck rotation, you might develop a little bit altered sense of consciousness. And we don't want that. It happens because there are two blood vessels which supplies the brain, which goes to the side of our neck, inside our vertebral body's side. These are called vertebral arteries. Vertebral arteries supplies the lower part of the brain, which is called cerebellum, which is responsible for your balance. We incorporate our breath, like we'll breathe out first, slowly take a deep breath in and drop my head to the back. Breathe out, slowly I'll put my head in the front. And listen to my body's signal. There will be no pain. If I feel any pain, I back off. The breath should be effortless. Effortless breath means what I'm doing. I'm talking. I'm even singing. And slowly head will come all the way down. Breathe in. Breathe out. To quiet down the mind and calm down the mind for our daily routine practice, we incorporate bumblebee breathing, Brahma Pranayama, with our Brahma Mudra or movement of your neck. It's a wonderful practice. Hand is there. See, in this state of relaxation response, what yoga therapy is, you will be able to keep as long as you want, because that is become your normal posture. Here it is. Look at me. I'm keeping my hand as a prayer pose to the back as long as I can. Now I'll breathe in, drop my head to the back, and with the sound of a bumblebee, I'll be putting my head in front. Breathe out first. Take a deep breath in. Breathe out with a bumblebee sound. Wonderful practice. Brahma Mudra has another 3 components. Putting head on the side. Breathe out first. Deep breath in. Head on the right side. Other side. Looking all the way to the back without moving your shoulder. Breathe out first. Initially, you have to do all with your eyes open, and slowly, when the balance gets better and better, you'll be able to do with your eyes closed. My practice most of the time with eyes closed, because in that situation, I know what I'm doing. I'm not looking at anybody. I'm not competing with anybody. Breathe out first. Slowly rotate your neck. Again, very slowly. Drop your head down. Breathe out first. Then by this process, what happens by this time, my hand goes up a little bit more, so more relaxed. Then you practice what is the real balance, which is a health. Health is a balance of your body, mind, and spirit. Balance is also maintained by your hands. When you fall down, see your hand always falls down first. In fact, it's an outstretched hand when you fall down. You get into the direct pressure, fracture your wrist, special name called a Colles fracture. So putting the hands to the back, you eliminate the component of your hands. Then another component is a vision. Vision is a big balance. So if you can stand with your eyes closed, that is a skillful yoga practice to bring your health back, create the transformation, treatment of the disease, maintenance of your health. Eyes closed, I'm standing on my left foot. Initially, it's almost impossible, and slowly, but also what you can start with your eyes open. Eyes open, I'm standing on my left foot. 10 seconds, 20 seconds, 40 seconds, then I see if I get eyes closed. Eyes closed, I'm still gets a little wobbly, but essentially I will be able to do it. I practice every single day. This is skillfulness in daily routine. On the right foot, 10 seconds, 20 seconds, 40 seconds, close your eyes, see how long you can do it. So when you do it longer and longer, you bring your health back and start fighting your chronic lifestyle-related disorders. Next, another skillful practice is keeping your head down below your heart. When you're able to keep your head down below your heart, initially the pressure inside your brain, called intracranial pressure, goes high up. Pressure inside your eyes, called intraocular pressure, goes high up. Pressure inside your blood vessels, like carotid arteries, your aorta, pressure goes high up. But if you can keep your head down, effortless breathing and no pain, slowly and slowly, baroreceptor sensitivity develops. Pressure inside the blood vessel starts to come down. Pressure inside the eye starts to come down. Pressure inside the brain comes down. You develop a baroreceptor sensitivity and also chemoreceptor sensitivity. Between these two combinations, you control your whole cardiopulmonary system. Chemoreceptors are responsible for your breathing. When you do the pranayama practice, like when you rapid Bhastrika pranayama, we create a hyperventilation syndrome. Chemoreceptors are responsible for controlling your lung function. And in yoga, lung and heart is the same organ. When you're dying and the lung stops, then the heart stops, and the brain stops, and all cellular function stops. And improve your lung function, improve your heart function, brain function, cellular function. So after this initial practice of this skillfulness, and after trying our head below your heart, we can do we call it a Prasharita Uttanasana. We separate our legs, we put our head down. I also do a little Kapalbhati Pranayama. Kapalbhati Pranayama gives you a relaxation response. Practice asanas in stages. Practice asana with no pain, effortless breathing, and the therapeutic asana called Sthiram Sukham Asana. Sthiram means stillness, Sukham is a happy, asana is a pose. That is the most important therapeutic asana described in Yoga Sutra, and we practice in our daily routine. In a daily routine, we continue about an hour of practice, 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. I've shown all the practices to you before, and if you want to continue those practices, you can go back to my YouTube channel. They're all uploaded in the YouTube channel. We do alternate, we do change our asana practices, but routinely every single day, we do our pranayama practice. And also in the morning, after the water intake or ushapan, we scrape our tongue, we brush our teeth, then we do a gel neti pot. We use the neti pot, wash one side of the nose, flush it, the other side, it opens your nostrils, you are very ready for pranayama practice, also a lot of other nice effects. We eat breakfast a little later. Morning in Ayurveda, according to Ayurveda, morning 6 to 10 is a kapha time. In kapha time, we have our slow Agni. Agni is your digestive fire. So, in yogic tradition, our breakfast is very little, but if we do a little breakfast, we push it around 9 o'clock or past 9. Continue our daily practices, then have a lunch in a called a pitta time, which is between 10 to 2. So recommend having a lunch between 12 to 2. During lunch, what you eat all the 7 coloring fruits and vegetables, not only green, not only red, the Vibgyor, violet, indigo, blue, green, yellow, orange, red. 7 colors of your rainbow. And also have a food with the 6 tastes. Astringent, bitter, pungent, salty, sour, sweet. In West, we have 4 tastes. Bitter, salty, sour, sweet. In Yoga and Ayurveda, we have astringent and a pungent. Astringent is the one which contracts your mouth, like a tannin, like a strawberry. The one in India is called amlaki, called Indian gooseberry. And pungent is your heat, like your chili, when you put a hot chili in your tongue. And you need to put all the 6 tastes because your whole digestion process starts with all the 6 tastes. Try to eat on time. Try to eat skillfully. Not to eat any fruits with your main meal. Fruit has a very strong enzymes which interferes with the absorption of trace elements. Also, it interferes with the metabolism in the liver. First one is called intestinal glycoprotein, interferes with the absorption of the trace elements. Another is a cytochrome P450, which interferes with the metabolism in the liver. If you're forced, or not forced, if you are given the choice of eating a fruit with your main meal, eat fruit first. Let the food go out first. Then, according to Ayurveda, you eat with your taste. You'll be surprised to know we eat sweet first. If you can't remember how to eat, best way to eat a main meal is from light to heavy. Fruit first and light to heavy. British rule, after dinner, rest a while, after supper, walk a mile. A British dinner means our lunch. The supper means our dinner. Yoga and Ayurveda says take rest. Ayurveda and yoga does not recommend a long nap. Short nap is okay, especially napping increases kapha dosha, which is grounding, it's slowing it down. But for a young child who's growing, and that is your kapha phase of life, we recommend them. And also people who are in the vata stage of their life, which we call our mature and senior people, they can have a nap to counteract their high vata dosha in their body. Afternoon, eat fruit as a snack. Eat fruit as a snack and also eat all the 7 coloring fruits and vegetables. Sorry, 7 coloring fruits. We always do it. You always do it. You get a blueberry, you get a strawberry, you get a blackberry, you will get a kiwi, you'll get a mango, all different color. Mango is yellow, kiwi is little green, blackberry is black, blueberry is blue, strawberry is little red, raspberry is red. So all the 7 coloring fruits. Afternoon is a good time for exercise. Remember, exercise is your muscle contraction. Exercise is sympathetic. Exercise increases your heart rate. Exercise increases your blood pressure, heart rate, respiratory rate. So once the sympathetic tone goes high up, body starts responding with parasympathetic activation. That's where the exercise works. If you do even if you do a walking, treadmilling, weight training, whatever you do, always stay behind your breath. Do not let your breath have any huffing, puffing, and you will see when you're behind the breath, you'll be able to increase your time in your running, time in your treadmill, elevation in your treadmill. In stages, impossible become possible. Same with the weight training. Even weight training, if we do the weight training, you have a weight, breathe in, breathe out, then do a bench press. Breathe in, and then do it with your eyes closed and paying attention to your breath. Biceps curl. Breathe in before a muscle contracts. Breathe out first. Breathe in. Breathe out. Breathe in. Breathe out. Generally, the muscle contraction lasts about 24 hours. So we recommend that you do the exercise every other day. So we practice every single day yoga practice after our morning rituals. 1 hour, 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. Exercise in the afternoon, generally about 40 minutes to 45 minutes, 20 minutes of your either a treadmill or walking or running with a graduated speed. And also when you do treadmill, slowly you build up the speed. 2.5 miles for 5 minutes, 3 miles, next 5 minutes, 3.5 miles, next 5 minutes, 4 miles, next 5 minutes, then a cool down period. Slowly, the way you go high up, slowly you come down as a cooling down. Elevation, same way. You can do slowly, 2%, 5%, even 10, maximum goes 15%. If you follow your breath, you'll be able to do 4 miles and 15% elevation very easily. And sustain about 20 minutes. Sustenance in the treadmill is your cardiac stress test. Weight training is saying, when we use our health tracker, we find when we do the weight training, suddenly our heart rate goes high up. If we do a 25 pounds of your bicep, suddenly your heart rate will go high up to 130 or 140. But this practice of yoga, with relaxation response, practice of your treadmill, walking, running, prepares you to adopt the sudden change in the heart rate and blood pressure. The worst thing happens in our life when the body is not adaptive. Sudden change in the heart rate or blood pressure will cause a plaque rupture. When a plaque, which is about 30-40% causing blocking, does not cause any reduction in the blood flow, if carotid artery, if it ruptures, it will cause a embolic stroke. Or when the rupture, it can totally even occlude the artery. In coronary artery, the same thing. Most culprit is LAD, or left anterior descending. You may have a 20, 30, 40% very smooth plaque. It's not doing any reduction in the blood supply, but sudden change in the heart rate and blood pressure. Ruptured the plaque, completely blocked the artery, totally shut down the blood supply to its territory. It causes a STEMI, and we call it a widowmaker. It affects your conducting system, and many of the people don't make it. Very effective therapy is your immediate angiogram, angioplasty, and a stent. We call it to the door to the cath lab. Very short time. You don't have too much time to let the myocardium survive. Anyway, so you adapt your sudden change in the heart rate and blood pressure. Dinner is very early, about at least 2 to 3 hours, 3 hours before going to bed. So, if you're going to bed at 10 o'clock, which is generally recommend, you try to have a dinner by 7 and 7:30. During meal, do not drink any cold water before. Cold water shuts down your Agni, Jathar Agni, digestive fire. If you want to drink, just drink little water in a room temperature before your meal. During meal, do not drink too much water, because you want all the digestive enzymes, digestive process to function. And that also is if you drink a glass of ice cold water with your food, the body does not function in that low temperature. Body functions in your body's room, which is the room temperature, body temperature. After the food is being really processed, we call turning and churning. It's like we call it your washing machine. 1/3 full, 1/3 empty, 1/3 water. So you get turning, churning. After about an hour, we drink a glass of water. In between, we drink water up to your thirst. We drink a glass or 2 glasses of water when you wake up in the morning, called Ushapan, and at night before going to bed. Either drink a glass of water or a glass of milk. And Ayurveda recommends a little bit of nutmeg and turmeric in the milk to drink. Sleep the way I showed you the sleep. Sleep like a baby with a Supta Baddha Konasana, incorporating your breath, first turning into the right side, then sleep all night on your left side on a fetal position. Generally, we wake up in the morning between 4 to 6. That is called your Brahma Mudra, time of the Supreme Being. And when you have adequate sleep, adequate deep sleep, you wake up without an alarm. You don't need an alarm. Your body is the alarm. We wake up very easily between 5 to 5:30. And you continue our same daily routine, very skillfully, on time, in stages, listening to our body signal, not competing with anybody, and slowly transform ourselves from rogi, people with a chronic lifestyle-related diseases, to nirogi, no disease, healthy, to a yogi and yogini who are the perfect example of health and wellness. Karo yog, raho nirog. Karo means do, yog means yoga, raho means stay, nirog means disease-free. Keep doing your daily practice, follow your daily routine skillfully. Like the Western way we can say, money back guarantee. Money back guarantee. You will bring your health and wellness back to be disease-free, medication-free, enjoying a good quality life. Thank you for joining. We'll come back again on the next Saturday and bring this topic, which is going to improve your health and healing. Next, let's see. Oh, next Saturday. Next Saturday is 25th. Yeah, June 25th. Next Saturday, I'm going to be in San Antonio, Texas. I'm going to present, actually I'm going to present the same topic. I'm going to present for an annual convention of AAPI, called American Association of Physicians of Indian Origin. And my topic is a healthy self-care routine. And after pandemic, this will be the first in-person conference I'm going to present. So I'm going to see you in 2 weeks in Saturday. Okay, see you in 2 weeks.